Before watching this video, I want you to go ahead and watch my lecture on thanatology, because that video is kind of like a trailer for this video where I have taught you everything that you need to know about death. Once you grasp that concept about death, you can move ahead and learn about the changes that take place in human body after death. And the changes that take place in human body after death is post-mortem changes. And on the basis of when these changes are seen after death, we have divided these post-mortem changes into three types, namely immediate changes, early changes, and late changes. Immediate changes are as a result of clinical death or somatic death or systemic death. Early changes are as a result of cellular death or molecular death. And late changes are as a result of decomposition. And if you are wondering what clinical death is, what cellular death is, again, I have taught you everything that you need to know about death under the topic of thanatology. Go ahead and watch that lecture. Immediate changes are seen within matter of minutes after death. Early changes are seen within matter of hours to days after death. And late changes are seen weeks to months to sometimes even years after death. Immediate changes include number 1, cessation of brain function. Number 2, cessation of circulation. And number 3, yes, you might have already guessed, cessation of respiration. The definition of death itself, the triangle, the cessation of brain function, cessation of circulation, and cessation of respiration. See, the cessation of brain function leads to loss of voluntary control over body plus insensibility. And this is the very first change that is seen after death. On the other hand, early changes include number 1, skin changes, number 2, eye changes, and 3 mortes. What? 3 mortes. Mortes, mortes, mortes. First one being algor mortis, then livor mortis, then rigor mortis. And yes, they are in sequence. Algor mortis is nothing but post-mortem chilling or cooling of body. Livor mortis is post-mortem staining or hypostasis of body. Rigor mortis is post-mortem rigidity or stiffening of body. Onset. Algor mortis is seen 15 minutes after death. Livor mortis is seen times 2, that is 30 minutes after death. And rigor mortis is seen again times 2, that is 60 minutes after death. What about late changes seen due to decomposition? So you have autolysis, where there is decomposition by the chemicals of one's own body, lysosomal enzymes. Putrefaction, adipocere formation, and mummification. So these are the changes that you need to know. Post-mortem changes are divided into immediate change, early change, and late change. Immediate change includes cessation of brain function that leads to loss of voluntary control and insensibility, cessation of circulation, and cessation of respiration. Early changes include skin changes, eye changes, and 3 mortis, namely algor mortis, livor mortis, and rigor mortis in that particular sequence. And the late changes are seen due to decomposition, including autolysis, putrefaction, adipocere formation, and mummification. Now, immediate changes I have already taught in detail under thanatology. So I want you to go ahead and watch that video if you want to learn everything about immediate changes, where I have taught you everything related to cessation of brain function, about brain death, coma versus brain death, brain stem death versus cortical death, everything about circulation and respiration, and the tests and examinations that can be done to test for brain death, test for cessation of circulation, test for cessation of respiration.